Welcome to the Expert Edge. This is the show where we bring on experts in their fields of health and wellness practice, hear their stories, and learn what they see working in the field of diabetes, reversal, and prevention. And I'm so happy to introduce today's guest, Dr. Mark Hinkes. Welcome, Dr. Mark.
Good morning, Lucia, and thank you for the privilege of being with you this morning.
We're so happy to have you. For those of you that have not met him, Dr. Mark Hinkes is a doctor of podiatric medicine who retired from clinical care after 40 years of service. He did 20 years in private practice, 20 years at the Department of Veterans Affairs, medical centers. He's been chairman of the Preservation, Amputation, Care, and Treatment Program for over a decade. He's also provided a variety of consultation services over the years. Before he moved to Nashville, he was the chief of the podiatry service at the Department of Veteran Affairs Medical Center in Salem, Virginia. He's served on multiple hospital committees, lectured nationally and internationally, and has published peer-reviewed journal articles. He's the author of 2 books on diabetic foot health and prevention. One is called Keep the Legs You Stand On, and the other one is Healthy Feet for People with Diabetes. You can get both books on Amazon. He is a board certified and diplomat of the American Board of Foot and Ankle Surgery and a fellow of the American College of Foot and Ankle Surgery and the American Professional Wound Care Association. He's a member of multiple associations, and there is much more to his resume that we're not going to go into today, but I just want you to know he is so well qualified to speak on what we're going to be talking about today. He's even ventured into the world of tech, developing a cloud-based tool for primary care providers to help them manage the foot health of patients with diabetes, focused on preventing amputations. In his leisure time, Dr. Hinkes enjoys raising roses, traveling, and creating stained glass art. So I love that. So many different things that you love doing. I don't know where you find time in your life to do all of that. But I would like to hear a little bit about your background story. Like, how did you get so interested in these preventive aspects of foot health? That's a topic so important to those that are dealing with prediabetes and diabetes to be aware of.
Thanks, Lucia. It's quite a story. The story starts off, if we get into the Wayback Machine, the story starts off in August of 1993. And I'm living in Miami, and Hurricane Andrew is forecast to come in Miami. It took a good day or two to prepare my home, button everything up. The storm came over my home. The north eye wall of the storm came over my home, and we ended up moving, my family, we moved from room to room. I saw a bicycle fly through my living room. We ended up 4 people. We ended up 4 people in a closet with arms linked and a mattress over our head, and then the roof blew off. So we were very fortunate to have survived the storm. Of course, my patient base was blown away. In one night, I lost my home, all of its contents, and my business. Wow. So I was given a mandate to leave Miami, and I ended up going to Salem, Virginia, to the VA. And the important thing about that is that when I was in Miami, I had a very nice podiatry practice. I was doing elective surgery, bunions and hammer toes and heel pain, sports medicine, orthotics, cutting toenails, corns and calluses. I had a very nice practice, but not too much involved with diabetic foot. When I got to Salem, Virginia, I went into the reception area for the main hospital. It was a pretty good sized room. And to my shock, I saw more people with one leg in one room than I had ever seen anywhere. I was not prepared for this. And so, being the position as the chief of the podiatry section, I needed to be prepared. And I literally went back to the books. I read everything I could. I learned, and I became very proficient. In that area, I also became chairman of the PACT program, Preservation, Amputation, Care, and Treatment. And I did that in 2 hospitals. I ended up doing that in Nashville, where I moved. And in Nashville, I did a research project wanting to see if I could really make a difference and prevent these horrific tragedies that I was seeing. And so I went back to evidence-based medicine, and I used that in conjunction with a risk stratification scheme from the International Working Group on the diabetic foot. I did a 5-year study, and at the end of the study, we found that we had reduced amputations by 40%, and we had decreased costs by 62%. So, having done this, it became very incumbent on me. When I had a patient in my chair, I knew I could help one patient because I knew what I was doing. But I know that there are millions of people worldwide. As a matter of fact, there are over 1 billion people on this planet who either have prediabetes or diabetes.
Wow.
And I know that 25% of those people will develop a foot ulcer in their lifetime. And a foot ulcer leads to a skin infection, a bone infection, hospitalization, amputation, and in some cases, premature death. And I said to myself, there must be a better way. We should be able to do something to help these millions of people and prevent these tragedies. And so that's the genesis of why I decided to go on this path of developing software that could be used via the internet by any connected device, by a primary care doctor, a nurse practitioner, or a trained technician, to evaluate each patient with diabetes, to identify their risk factors for developing a foot ulcer and mitigating those risks. By knowing about them, you can mitigate them. And then we would stratify people into internationally accepted risk categories. And then we would also know how often we should reevaluate these people. So it's a very, I've taken a big bite.
Yeah, you have. And I love what you are doing because it is so relevant. I come from a family full of diabetics, and I've seen multiple amputations, shortened life, loss of limbs and toes, and what have you, over the years. And it's always a tragedy when someone is hampered, decreases mobility, loses function due to these complications of chronic high blood sugars. And I believe that prevention is really the way to go because prevention is so much easier and effective than trying to treat these problems once they've developed. So let's look a little bit at what some of those root causes are. When you see diabetes-related foot ulcers that often end up as amputations, what's really behind that?
That's a super good question, and I appreciate it. What people with diabetes and their caregivers need to understand is that diabetes is kind of a condition that sneaks up on you. One day you feel good and you say, well, I'm doing good, even though your blood sugars might be high. But eventually the chronicity of having elevated blood sugars will become deadly. Chronically elevated blood sugars cause small vessel disease. And the reason for that is that the small vessels are the most vulnerable to the changes in blood sugars. So where do we find these small vessels? Well, they're in the eyes, the kidneys, the cardiovascular system, and the feet, because the feet are the farthest away from the heart. So because of the blockage of the small vessels or the stenosis of the small vessels, the nerves, which depend on these small vessels for nutrition and oxygen, don't get it. Therefore, people with diabetes can develop three types of neuropathy. They can develop sensory neuropathy, which is an inability to feel pain, motor neuropathy, where the muscles in the feet lose some of their mass, and so they lose their function, and people have a tendency to fall. And autonomic neuropathy, which controls the automatic functions of the body. And the manifestation of autonomic neuropathy is dry, flaky skin, thickened keratosis, and in some cases, the development of a deformity called Charcot foot, where the mid-tarsal joints, the mid part of the foot, literally collapses with hundreds of microfractures. And this is probably one of the ugliest things that happens to people with diabetes, because it can take up to a year to heal this problem. And even if we have a patient in a wheelchair or non-weight bearing for a year, they still may need to undergo a surgical procedure where we would use a halo. We would put rods through the foot to hold it in the position that we want it to heal, and then put a halo around it. So it gets to be, it's a very sophisticated treatment for a very difficult problem.
Mm.
So the thing that I want people to understand is that controlling blood sugars is the key to prevention.
Mm-hmm.
And I want to talk a little bit about something called a continuous glucose monitor, if you'll permit me.
Sure.
All right. My wife is type 2, and she'd been sticking her finger for, long time before I met her, 30 years. And I would watch her do that, and I would just always go, ooh, that's got to be uncomfortable.
Mm-hmm.
And I said to her, hon, why don't you get a CGM? And she really didn't want the CGM. And I said, why? And she said, because I don't want to know how bad my blood sugars really are.
Mm-hmm.
And there are a lot of people out there like that.
Mm-hmm.
But here's the benefit of a CGM. It will tell you what's called time in range. And what we want to know is, how long are your blood sugars in what we call the normal range, is between 80 and 120? And how high or low are they from normal, and for how long? And the reason this is so important is it gives us a better sense about what kind of pathology may develop because of the amount and time that the blood sugars are out of control. So it sends her like a little beep on the phone, and it says your blood sugar is high, your blood sugar is low, whatever it is. So
Yeah.
I even have an associate that wears a CGM. It's a little kind of a white thing that people stick behind their arm there, and he has that hooked up to an insulin pump.
Mm-hmm.
So he's my bionic friend. So for people that are on the fence about using a CGM, I would like to encourage them to please consider it. It'll be such a positive move in their life in controlling their blood sugars, which is going to translate into a better quality of life.
Absolutely. I love using them with a lot of my clients because what I find is that many people don't actually realize the direct effect that their lifestyle choices are having on their blood sugars. For example, people start to realize that, oh, I got really stressed about this conversation and look what happened to my blood sugar without even eating. Or I decided to walk for half an hour after my meal, right as soon as I was done eating, and I saw a 70-point drop in those 30 minutes. That would have not happened for maybe 3 or 4 hours if I hadn't done the exercise. So I think CGM combined with lifestyle can be a very powerful tool for people to actually get motivated and start seeing the connection between what they're doing and their blood sugars. And I think that is an amazing tool for helping people really get motivated and say, I want to do something about this, and I can do something about this, because they start seeing direct effects from different choices and how it impacts their blood sugars. So I love that you brought that up. Now, as we look at what happens when we don't control these blood sugars, and over time we experience this damage due to circulatory impairment, as you were describing, where the nerves aren't working properly because they're not getting the blood supply that they need. What are some of the statistics around the development of diabetes-related foot ulcers and subsequent amputations?
That's a really good question. I think we need to take a step back for a second and talk about
Sure.
how and why do people develop foot ulcers? Because
Okay.
this is leading into what you're asking about. The combination of chronically elevated blood sugars results in neuropathy, which we talked about previously, and peripheral arterial disease. So these two physiological problems that people have set the stage for the development of an ulcer, but they are not totally responsible for the development of the ulcer. There has to be a triggering event, and a triggering event is trauma, and it can be mechanical, chemical, or thermal trauma. So, for instance, mechanical trauma is you get up in the middle of the night, you don't put your slippers on, you're on your way to the bathroom, and you catch your foot on the door frame. Or you go to the refrigerator to get a ketchup bottle and it drops on your foot. Or you're out walking without the right shoes on, or your shoes are too tight, or you're not wearing socks. So there are probably hundreds of reasons for mechanical trauma. Chemical trauma comes from using over-the-counter products that contain salicylic acid, and usually find this in compound W, outgrow, wart be gone, ingrown toenail remover, whatever it is. So, my advice on that is just don't even go near that stuff, especially if you have diabetes or peripheral arterial disease. And the third triggering event can be thermal, and that can be heat or cold. And I had a patient come in that was wearing sandals and all of his toes were just red, and I couldn't understand what was going on until he told me he was out walking in the sun, so he had sunburn on his feet. So understanding the triggering events, it helps for people to prevent the ulcers. Now, when you get an ulcer, as I said, there's 1 billion people on this planet who either have prediabetes and diabetes. And 25% of those people in their lifetime are going to develop a foot ulcer. That's 250 million people. That's a frightening statistic. Okay. We talked about why ulcers are dangerous, because 85% of these foot ulcers are present and cause amputations. So the philosophy here is if you can prevent the foot ulcer, you can prevent all the sequelae, which is the infection, hospitalization, amputation, and so forth. So what I really want to do is I want to educate people with diabetes and at-risk limbs about how to prevent a foot ulcer, because if we do that, the rest of it never happens, and they live happily ever after, if you will. Okay, so 38% of the people who end up with an amputation will lose the second leg in 3 years.
Wow.
And near 70% of the people who have an amputation will not survive 5 years. So if you look at the mortality statistics, the mortality associated with a diabetic lower extremity amputation is greater than all forms of cancer combined, excluding lung and pancreatic cancer. So the message here is look at your feet every day, take good care of them. I have a 3-page handout that I give to my patients, or I used to give, and have professional foot care. I had a patient come in one day where the bone was actually sticking out of the end of his second toe, and I asked him, and I said, what happened here? He said, well, I was cutting my toenails. And we got to understand, people with diabetes, not only do they have the problems with their feet, but their eyes are bad too. So, I don't want people to be bathroom surgeons. They don't have sterile instruments. They don't have good lighting. They don't have good eye motor coordination. They certainly, sometimes miss, what they're trying to do. So, it's better to have professional foot care by hopefully a podiatrist or a dermatologist or some other professional who can give proper care.
I think that's such an interesting and important aspect of prevention, because many, if we think about the numbers of people that you're talking about that are going to end up with foot ulcers, we don't have enough specialists in the world probably to take care of those things in a specialized way. So it's like we don't even have enough podiatrists available to do the kind of care you're talking about if people allow these things to advance the way they often do. So prevention is really the best answer. And I love the handout that you have that we're going to be sharing, by the way, with you all. It's going to be in a link in the description to this video. So look right below this video, wherever you're watching it, and you will see a link to this free handout that Dr. Hinkes has created that will really help you to understand, what do I need to be watching for? What is important for me in terms of caring for my feet, so that I don't develop an ulcer. If I develop an ulcer, I don't lose it. And I had a question about some of the numbers you were just sharing with us about risk of losing a second limb if they have lower extremity amputation. Did that include toe amputations, or was that like ankle and higher? I was just curious.
That's ankle and higher.
Okay. Because I know a lot of people that may not lose their foot, but will lose toes, multiple toes sometimes. And that in and of itself creates a lot of has a lot of impact on their ability to work and walk and so many things. So, even if you don't lose your foot, even losing a toe or two or three can really impact your ability to live the kind of life you're used to right now, if that's not prevented. So I love your message of prevention. What are some other things that you have noticed with maybe some of your clients, people you've worked with, that are often overlooked or might even be overlooked by their doctor?
Yeah. I want to talk about the issue of the primary care provider and the endocrinologist relative to the patient with diabetes. The ratio of endocrinologists to adult patients with diabetes in the United States is about 1 to 5,000. So clearly there are not enough endocrinologists to serve the needs of people with diabetes. And as we know, diabetes requires a specialist. It's a very complex condition, and there's a lot of different things that affect it. And unfortunately, primary care providers end up taking care of 90% of the people with diabetes kind of by default because there aren't enough endocrinologists around. Now, the other issue, there are several issues with this. And by no means do I mean to diss the primary care provider, because these people are hardworking, they care, they want people to be healthy. But unfortunately, what's happening in medicine today with managed care and burnout and the need for primary care providers to see more patients in a shorter time, because they have 10, maybe 10 or 12, 15, 17 minutes to see people. They just can't do everything. And unfortunately, what tends to happen is many patients with diabetes never have a foot exam. Or if they have a foot exam, it's very limited. And one of the other things that's happening with primary care providers, 70,000 of them retired last year, and we're not replacing them. So we don't have enough endocrinologists. We don't have enough primary care providers. One of the real good spots about what's happening is nurse practitioners. There are now actively practicing 400,000 nurse practitioners in the United States. And these are the people that I am hoping are going to have that few minutes to take a look at the patient's feet. But typically what happens is if the patient doesn't get a foot exam, there are gaps in care because pathology is not identified. And of course, one of the things that primary care people don't, and I'm going to say this in a loving way, they just don't know the contents of what a comprehensive diabetic foot exam entails, according to the literature. And so these gaps in care, failure to diagnose, result in pathology. And it's not just foot pathology. If you look at diabetic patients, they're going blind, they're going on dialysis, they're having heart attacks and strokes. So, but that's where my focus is on feet. And what I really want to say is that these screening exams are really mandated to be done every year. But in fact, they're not. However, coming up in the next year or two, there's going to be a HEDIS mandate for a foot exam, which means everybody's going to have to do it. And if they don't do it, they're going to get dinged, which means financial problem. So things are changing, and they're changing slowly. But the idea of a patient getting a foot exam happens in two different ways. And what we need to look at here, Lucia, is the business model of the primary care provider. There's two business models right now in the United States. One is called fee-for-service, which is the one that most doctors are using. And then there's another one called value-based care. In fee-for-service medicine, there's very little prevention and there's very little counseling on people about how to prevent. And one of the reasons is in fee-for-service medicine, they need you to be sick. If you're not sick, you're not coming in, and it's an awful reality. So it's not that they don't want to help you; that's just not their business model.
Yeah.
The
And
other,
go ahead.
I'm sorry, the other business model is value-based care,
Mm-hmm.
and value-based care incentivizes physicians and to educate and motivate patients to perform comprehensive foot exams. And financially, what happens is whatever the government, whoever is sponsoring that patient, gives the group of providers a bucket of money. And that's all the money they get for the year to take care of all of this patient's healthcare needs. If they do a good job, they educate the patient on prevention, they keep an eye on them, they do good, keep the patient out of the hospital, whatever money is left over at the end is their bonus. So
And that sounds to me like a great way to incentivize prevention. And I wanted to share this is the cover of one of your books, Healthy Feet for People with Diabetes, because if you're listening and maybe you're not a healthcare provider and maybe your healthcare provider isn't quite up to speed, as Dr. Hinkes has talked about with foot exams, you can educate yourself. Like this book is a full color book. It's written in a way that anybody can understand, and you can get a kind of a head start on taking care of your feet by checking out the information in this great resource. How else would you encourage people to use this book?
this book has lots of information on kind of mundane things, but things that people take for granted. Mm-hmm. So this book is also being used as a textbook in a couple of nursing schools to help professionals get a better grasp on everyday problems that people kind of look at and don't pay much attention to.
Yeah. So I just really appreciate you putting that resource together that can be used both by lay people and by professionals, because I think the more people understand and know and become aware of the importance of taking care of the feet, especially of people that are pre-diabetic and diabetic, that we can really have an impact in decreasing people's losing of their toes and their legs and what have you, because that's no fun. And we're all about prevention as well. So are there any last words of wisdom you want our listeners to take away with them today as we have them thinking about the health of their feet?
Yeah. Thank you. Yeah, I think patients need to be proactive. If you have diabetes or peripheral arterial disease and you go to your primary care provider, take your shoes and socks off. And when the doctor comes in, ask for a foot exam.
Great tip.
Yeah.
Great tip.
This is, the only way that people with diabetes are going to really prevent these tragedies is for them to become proactive.
And, I really love that, because that's a big part of my message as well, because I want everybody listening today to walk away remembering that health is wealth, and it comes by choice, not by chance. So as you take charge of your own health and you are proactive, like you ask for the foot exams, these sorts of things, I think you will be able to enjoy much better health going forward and avoid some of the most devastating complications of chronic high blood sugars and diabetes. So I just want to say thank you so much for being with us here today, Dr. Hinkes. I think this has been super valuable, and I know that people are going to walk away with some really important concepts they can apply in their lives easily and practically. Thank you.
Thank you, Lucia.